President Marcos says that one of the areas that he succeeded in his first 100 days in office is health. Let's discuss this assertion some more with Dr. Maricar Limpin, former president of the Philippine College of Physicians. Dr. Maricar, good afternoon. Thank you for joining us. How would you rate the president's first 100 days, at least in terms of the health sector?
Well, actually, maybe as far as the control of the pandemic, there seems to be some continuity with the presence of OIC Secretary Rosette Vergere, at the helm of the Department of Health. But of course, for us in the healthcare sector, we would love it if the president has already designated a definite Secretary of Health, not just on an OIC capacity, but really, taking the leadership as far as the Department of Health is concerned. So that, the problems such as COVID-19 and the other many problems concerning health will already be taken care of.
All right, I think right now, of course, apart from COVID-19 booster vaccinations, I think last week we were talking about the warning that by the first or second quarter of next year, we would have a measles outbreak due to low pediatric vaccination turnouts. How do you recommend we handle this without, like you said, a fixed Secretary of Health?
Yes, I think OIC Secretary Vergere will probably be able to come up with certain programs, to improve the vaccination, the immunization, of the children against many infectious diseases. But then again, we still need to put in a lot of effort, to really encourage more of the parents, to have their children vaccinated. Unfortunately, the targets we have not, as far as vaccination is concerned, have not been achieved, for the past many years. And now, so we see a lot of our children really getting a lot of measles, getting infected with dengue, and even the tuberculosis is also getting to be a problem. We are now number 4 as far as the burden of TB all over the world. So these are big problems, and I believe that having a fixed secretary will really be able to help combat or fight these health problems.
All right, well said, Doc. Another issue, of course, plaguing us in terms of the health sector is the migration of health workers to other countries with better pay. How should the government address this? Would appointing a permanent health secretary help this case at all?
Well, we would like to believe that with a fixed Secretary of Health, that particular person will be able to make the necessary recommendations, to maybe improve, the situation, the remunerations, of our healthcare workers. The primary reason why we are now facing brain drain as far as the health human resource is concerned is because of better opportunities in other countries. So we need to make sure that the pay that will be received by our healthcare workers will be improved. We cannot continue with what we have right now, so because the problem of migration will continue if we don't do anything about the remunerations of our healthcare workers.
All right, and of course, going back to COVID, of course, we cannot forget that we are still in the middle of the pandemic. About a month ago, the president relaxed the outdoor mask mandate, and some people have said that this has caused a slight increase in COVID-19 transmissions, although hospitalizations remain low. Do you find this worrisome at all, this relaxing of the mask mandate?
Well, of course, it's it's worrisome as far as healthcare workers are concerned, no? Because we see really an increase in the positivity rate of COVID-19. We really see more people, no, getting infected, and not only getting infected, but also getting serious disease, no? You have to remember that definitely there will be more people getting admitted to the hospitals, getting serious infections, no, as the number of people increases, no, infected people increases. So, I think the the hospital utilization is not necessarily, may not necessarily be true, no? Really, really true. Why? Because many of the hospitals are not really able to accommodate many of the COVID-19 patients simply because they do not have enough manpower to look after admitted patients. So, kami na mismo mga nasa ospital ang basically, no, ang talagang parang nagiging dahilan para hindi ma-admit ang ibang mga tao, no? So, I think we need to think about it, no? The low utilization, hospital utilization may just be apparent, no? It may not be really true because many of the people who are supposedly to be admitted are not necessarily being admitted in many of the hospitals because of the lack of manpower.
All right, thank you again for your time and your insights. Former PCP President Dr. Maricar Limpin over Zoom. Thank you, Doc, for joining us this afternoon.